We are back with more What's Now. It is flu season, unfortunately, so it's a time to get your flu vaccine. What do you need to know about this vaccine for 2021? Well, let's find out.
Despite risk, 60% of Americans say they may delay or skip the flu shot this year. Today, we have a leading medical expert here to discuss everything that you need to know about this flu season, including why you should get your vaccine now and to bust common myths about the flu vaccine. Joining us is Dr. Donald Lloyd-Jones, president of the American Heart Association. Dr. Lloyd-Jones, thanks for being here today. How are you?
I'm well, thanks. So great to join you. Appreciate it.
Why do people delay or not get the flu shot?
I think it's a great question. And the American Heart Association actually just commissioned a survey of Americans to find out the answers to that very question. And we actually found that there were kind of three common reasons: side effects, they don't think it'll work, and also they think they need to space out their vaccines. But it turns out that I think we can bust some myths on all three of those. The first is, of course, you're going to have some side effects, but usually that's just a mild sore arm or maybe some chills for a few hours. That is not you getting the flu. You can't get the flu from the vaccines that we currently have. Whether it's going to be effective, we know these are very effective vaccines. And some of my patients tell me, well, I got the flu anyway. Probably that was a different virus. These vaccines are really effective at preventing the true flu. And believe me, you do not want to get the true flu. And then finally, CDC now says it's safe for us to get the COVID-19 vaccine or our booster and the true influenza vaccine on the same day. So I'd recommend people just get it all done at the same time.
How is COVID-19 impacting people's decisions to get vaccinated against the flu right now?
Well, I think we're much more focused on our health this year after what we've been through with the COVID pandemic of the last year. Looking back, we had a very mild flu season in 2020 to 21 last winter. And that was because we were doing such a good job with masking, social distancing, washing our hands. But this year, the flu will be back. So I really hope people are focused on the flu as well as COVID-19. And one of the things we saw in our survey, which I think is encouraging, is that particularly among people of color, in our Black communities and in Hispanic individuals, we saw that COVID-19 and their experience was actually making them more likely to be motivated to get their flu shot. So I hope that's true for everyone.
When is the best time to get your flu shot?
How about now? Flu shots are widely available now, pretty much everywhere. And usually around Halloween is a good time to be thinking about getting it, because the flu starts to peak up in December and usually hits high point in January. So you want to make sure you have your immune system ready for that to protect you if you get exposed to the virus as we get into the winter months.
What should we know before we get the flu vaccine, and who should be getting this vaccine?
Yeah. Well, the recommendation is that everyone 6 months and up should get the flu vaccine. There are very few people who would be excluded from that recommendation. And it's particularly important, I think, for people who have risk factors for heart disease or stroke, or have already had a heart attack or a stroke. So if you have obesity or high blood pressure or diabetes, get those under control, and at the same time, make sure that you're getting your flu and your COVID vaccines. The flu can trigger, when it's really severe, can trigger things like heart attacks and strokes. And that's why we want people at risk to be well protected. But the truth is, everyone should get it, and it's the best way for us to protect ourselves and our families from spreading the flu.
And if you're not sure where to get your flu shot, what do you need to know about that?
Well, again, they're widely available. So you can call your doctor's office. All the federally qualified health centers have them, and even your neighborhood pharmacy is going to be making appointments to give flu vaccines pretty much everywhere now. So it's free with most insurance plans. You can walk in, often get it just with a walk-in, or if you need to, go ahead and make an appointment, but get it done today.
And anything else we need to know, and where can we go for more information?
Yeah, so the Heart Association has set up a really nice information page on our website. You can go to www.heart.org/flu. And I think a lot of questions will be answered for people there.
Well, thank you so much, Dr. Lloyd-Jones, for joining us today. Really appreciate this information about getting our flu shot. Thanks for your time.
It's my pleasure. Thanks for your interest.